COVID-19 has catapulted telemedicine to the top of the agenda for many business people. Loblaws just said its Shoppers Drug Mart unit is investing $75 million in one online health producer. It's called Maple. We're joined now by Brett Belchetz. He's co-founder and CEO of Maple. Thanks very much indeed for coming on the show. Tell us about Maple. What do you actually do? I know you do a lot of stuff, so keep it short, but give us your basic activities, please.
Well, good morning, and thank you for having me. What we are is we are an online platform that facilitates healthcare visits between healthcare providers across Canada and patients across Canada. We started the company in summer of 2015, so we've been around for about 5 years. And we've rapidly grown to a place where we have about 1,000 healthcare providers across Canada practicing on the platform and providing healthcare services to about 1 million Canadians. And we're growing quite rapidly month over month. And we provide our services directly to Canadians who are in need of healthcare from either physicians or paramedical providers. We also provide services through employers, insurers, and we also license out software solutions to hospitals, governments, and clinics and individual healthcare providers.
So, I mean, if I sign up, I can actually consult with a doctor by video call or Zoom or whatever it is on your platform?
Yes, you can. So if you had a medical need, you would create an account on our app, log in, click a button, just like you would in the Uber app if you were going to get a car, and click a button to request the first available doctor. And we're available across Canada, all provinces and territories. The service operates on a 24/7 basis, so every single day of the year, doesn't matter if it's Christmas, New Year's, or 3 in the morning, there's always doctors available. And our average wait time since we started the business on a 24/7 basis to see a doctor is under 5 minutes. It's actually typically under 2 minutes. So it's almost instantaneous access to doctors when you need them.
How much roughly would it cost? Say I signed up as a new customer. I mean, how much would it cost me to get in touch with a doctor and say I'm having this problem and to get a diagnosis and possibly even a prescription if that's warranted? How much would it cost me?
So it really does depend what part of the country you're in. In some parts of the country, there is very good public coverage. So in British Columbia and now in Alberta, there's permanent public coverage for online doctor's visits. In other parts of the country, there is some temporary coverage related to COVID-19. If you're in a part of the country where there isn't public coverage, you can pay for the service privately, and the charge for that private visit is $49 during the week. It goes up a little bit on weekends to $79.
Is this in some ways a reflection of problems, delays within the healthcare system, even leaving the pandemic out of it?
Well, the whole reason we started this company was due to issues with access to care here in Canada. So we're all very proud of our healthcare system here in Canada. It's a very good one. But in terms of wait times to access family doctors and specialists, we have the longest wait times in the developed world. So if you look at the stats, what we see is that more than half of Canadians are waiting 48 hours to actually get a hold of a family doctor when they have a medical need. 1/3 of Canadians wait more than 7 days to get a hold of a family doctor when they have a medical need. And certainly, as we all know, when you have medical symptoms, that's not good enough. And my background, I was an emergency room physician for many years and still do practice. This was something that I lived and breathed on the front line. So we really started the company to solve this issue, to make it possible for Canadians to get access to doctors right away when they needed them, rather than waiting days and potentially having their medical issues worsen while they were waiting.
I know this is a complex issue, but I mean, are you skirting the law here? I mean, we're not really meant to pay to get access to a doctor in Canada. It's all meant to be billed through a provincial plan. I know that's not true of massages and stuff that's covered by insurance or whatever, but basically accessing a physician, isn't that supposed to be always paid through a provincial plan?
Well, ideally, that would be the case, but we have a long tradition in Canada of healthcare that is either covered by the government or not covered by the government. So there's lots of examples of services that the government has chosen not to cover. So things like, for instance, laser eye surgery. When you want to go get your laser eye surgery done to fix a valid medical problem like myopia, this is something that the government has said they're not going to cover, and you have to pay for it out of pocket. So virtual care is very similar, in that for the most part, it's been something that governments have chosen not to cover. The good news is that we are entering an era where more and more governments are choosing to cover it, particularly related to the pandemic. So the hope is that as we go forward in time, there will have to be less and less private coverage of services like this and more ability to use your health card and not have to pay out of pocket for services like this kind of a service.
That's interesting. I know we can't get into the full politics of this, but some people are going to be watching and say, well, is this at the thin end of the wedge, privatization of healthcare?
I wouldn't say that at all. What I'd say is that there are always going to be new kinds of services that the government has not thought of, and therefore they're not covering. And there's two ways that we can get these services to be available to the Canadian public. One is we wait years and years, and we hope eventually the government takes notice of these services, and we hope that eventually they'll cover them. And sometimes that does happen, but it can take a very long time. The other way that we get services covered is it begins to be something that's privately offered. So laser eye surgery would be a good example. Even fertility treatments for a long time were not covered in many provinces. And then eventually what happens is people realize that these services work. They're demanded by patients in the country, and eventually government takes notice, but much faster than they would have if it wasn't available at all. But eventually government takes notice, and then government chooses to cover it. So I would actually say that bringing these kinds of services in and bringing them in a way that they're privately covered is a really good way to get government's attention and show government that these actually work, and give government a really good argument as to why they should be part of this and covering this themselves.
That's an interesting point, actually. Yeah, and I mean, the reality, I think you said, lots of people can't get access to a doctor for days, for a week or something. Brett, we'll have to leave it there. Thank you very much indeed for joining us.
My pleasure. You have a wonderful day.
Brett Belchetz, thanks, co-founder and CEO of